Welcome back to Hospital Rounds. I'm so excited for today's video because we are taking a tour of the outpatient physical, occupational, and speech therapy department at Three Meadows Medical. Just as every nurse and doctor have to round on their patients to ensure timely care and keep them updated on their care plan, so we are using this video series to round on the different services and units at our hospital to keep you, our community, in the know and up to date on what's going on at Hillsdale Hospital and what services you should know about. I'm so excited to be here today with Amy Doyle. Thank you, Amy, for being here.
Sure.
Amy is our registered occupational therapist and the director of our rehab services. Amy, will you please introduce yourself to our community and tell us a little bit about the services that we have here?
Sure. As she said, my name's Amy Doyle. I am the director of rehab. I've been here at the hospital for about 14 years in that role. I've been a registered occupational therapist for 30 plus years.
Wow.
I won't give you exact. I am not originally from Hillsdale. I am originally from the Ann Arbor area, moved out here about 15 years ago. Love it. We'll probably never go back.
Oh, great.
As far as services that we do offer physical therapy, occupational therapy, and speech therapy here at the hospital in an array of different departments. And I would say our vision is really to just provide quality services for physical, occupational, speech therapy for any patients that may be in need of those services.
Yeah, and you do a fantastic job of it. You make such a positive difference for our community. I've heard just excellent praise of this department. A lot of patients come and kind of are a little bit nervous about their PT or OT or ST, but it always goes so well. I hear from patients, and it's just such a wonderful service to be able to provide to get people back on their feet or back to work or whatever their goals are.
Absolutely.
Sometimes after an injury or sickness, but we'll talk more about that in a minute. Another thing that's important to know is that we do offer these services inpatient for our skilled nursing facility. We're going to talk a little bit more about that soon in an upcoming video, but today is going to be all about the outpatient side, and you'll see a few different areas of the facility, and we'll talk to some more staff members, so stay tuned. I'm excited to talk to Tracy next. She is one of the staff members at our front desk who helps check patients in and get them started. Tracy, can you please introduce yourself to our community and let us know what your role is?
So my name is Tracy. I'm the office assistant here at Outpatient Therapy. I've been here for 3.5 years.
Okay, wonderful.
So I'm not originally from Michigan, but I love it here.
Oh, that's great to hear. We love Michigan. Can you tell us a little bit about how patients can get started with these services if they get an order from their doctor, or maybe they're coming out of a surgery where they'll need some rehab? How do they get started?
So, how we start is we get referrals from the physician.
Okay.
And as soon as I receive that referral, usually via fax, or a patient can hand deliver it as well. Okay. I will make sure it has all the information that we need.
Okay.
And once that happens, I'll call the patient, or if they're here in person, we'll go ahead and find a day and time that works well for them. And after the evaluation, if they need authorization, we'll get that.
Yeah.
We take care of that here in-house. And if they don't need authorization, we'll go ahead and schedule as far out as they like.
Wow, so very straightforward, very simple. And I'm assuming after an appointment, you schedule kind of follow-up appointments, or can you get something recurring on the schedule?
It depends. We try. The further out we go, we can. If somebody wants a Tuesday, Thursday at 1:30, forever and always, well, I'll do my best to make sure that happens. So,
that's wonderful. I love that it's personable. There's not a lot of hoops to jump through. It's pretty easy for the patient, and that makes it a lot more accessible. So thank you so much for the work that you're doing and for your friendly face at the front desk. We appreciate it. I'm excited to be here in the gym. This beautiful facility is so wonderful for our patients. I am here with Nick, our doctor of physical therapy. He is one of the therapists that you might see here and have treatment with if you're receiving services at the Three Meadows Medical Facility. Thank you so much, Nick, for being on the video. We appreciate it. Can you introduce yourself? Tell us a little bit about your role here in this department.
Sure. So myself, Nikita Patel, but I go by Nick. Everybody knows me that way. So thank you for having me today and giving me opportunity. I'm really excited to share the things that you might love it. So I graduated my PT school in India back in 2014. Came here and did my doctorate here in University of Montana, and I found this beautiful community to work here.
Well, we're so glad you did. I know that your patients love you. Absolutely. We're going to talk about a few different things, but primarily let's walk through this wonderful facility. And can you tell us what some of these pieces of equipment are? They might look a little bit intimidating for someone who's never come and done PT before. And let's also talk about, as we kind of walk through, let's talk about the conditions that might lead someone to need physical therapy.
Sure.
Yeah.
So we're going to start from here.
Perfect. What's over here?
So we got the parallel bar, like here it comes. Let's say they have a lot of fallings that they cannot stable themselves.
Okay.
We can start some exercise doing like holding it here.
Okay.
We got the beautiful bands out here that really help in your getting strength.
Okay.
We got a little bit big equipments for your leg strength. We utilize those balls. You might be wondering that we help really those balls to create your core strength. And then here we got another equipment like everybody loves new step and steps. So that helps really to improve your leg strength and core stability.
And I'm assuming after something like an injury or if someone's been really ill, that's helpful?
Yes. So we see a lot of like post-op people, like let's say total knee replacement or hip replacement. Those are really helpful, improving their range, mobility, and strength. For shoulders, we got the upper body kind of cycling, I would say. Yeah. So that really helps in your mobility, decrease your pain, swelling, and gain strength.
Gotcha.
The treadmill, everybody's favorite. We walk every day, right? So that's what we use for like starting or targeting, isolating some muscles. We can really stand next to them and just try initial phase to targeting individual muscles.
Absolutely.
And then we're gonna start training them for gait or for walk. For better mobility.
Okay. What's over here?
So this is I love the most because so this is like ultrasound and TENS unit that really helps in your pain, inflammation, and all that stuff.
So if a patient is feeling pain or something, you can kind of take a closer look right here in the gym and figure out what's going on.
Yeah. So at evaluation, we create kind of protocol like what number. There's some like dosages and everything that we're gonna work on, and we put it in, and our assistant people, they put it in and just try that. This ultrasound, and this is called iontophoresis. This is really helpful. We use some medication like steroids and a lot of other stuff that really helps your acute injury and acute pain, swelling and all that. So people can see really difference. A lot of people don't like injection or shots. So we can utilize that as a steroid medication, put it in the shoulder, knee, and stuff like
I've never heard of that.
Yeah, that really helps in your pain. Yes.
That's incredible. Okay.
So this is, and that one is the same, but this is just a TENS unit. That's, people love it after the workout. And that really helps in your pain, muscle strengthening as well. Like there are so many purposes we can use it.
How does that work?
So basically, let's say if we have a stroke patient and they're not able to move their muscle. So there are certain protocols we can put it on and we can try to activate those muscles. So that kind of give them like a neuromuscular re-education that starts to improve their contractions and slowly day by day improves their gaining their strength and able to walk.
That's very advanced therapy, and it's not, I think
it's not just for the pain.
Yeah, that's incredible to really regain your life back.
Exactly.
If it
mobility, independence.
Yes, that's so impactful. Okay, well, what is over here?
So this is another like a squat machine, I would say. Like we see a lot of variety of people with age group, like older people, younger people. So like someone has a problem doing a lot of like mini squats, we can just incline them and they can do easily. So we can start from here.
Makes it easier.
Yes, and progress it to the against the gravity so they can do like the daily activity and stuff like that.
Yeah, for bending.
Yes.
That makes sense.
Yes.
Yeah. Okay.
This is just standard treadmill, new step. Everybody loves this too.
Yes. Just so many tools to get exactly what you need. Tell us a little bit about the patient care approach. What is unique about the way that we do physical therapy here?
So my personal approach is like hands-on therapy, and I literally focus on more of evidence-based practices, which really helps and give their strength, mobility, independence. Because we have seen a lot of people like they just come and just do it. That won't help. You have to go with the evidence-based. That's like a research telling you doing this will help you that. So that's what we are standard practicing here.
Yeah, so evidence-based, very hands-on, personable. How would you say are services and the way that we do this are different from maybe some other experiences that a patient has had with other facilities and services.
Sure. So I used to work with one clinic, and they were like giving us 3 patients at a time.
Oh, wow.
And you have like 30 minutes to see those 3 people.
Oh, wow.
Yeah. So, but what I like the most here, I've been here like 4 years, and I love it here. Love this community, especially Hillsdale Clinic. So they give us like a one-on-one approach, like 45 minutes session, but you can directly give them patient direct care, and that's what I love the most, because I'm a human being too, so I cannot focus on like 3-4 people, something going in my mind. I don't like it personally as a clinician.
Absolutely.
So with here, like one-on-one approach, we really love it. We can focus on their problems and needs, and we can work accordingly.
It's personalized.
It is.
That makes such a big difference, especially after something like a stroke or an injury or big surgery, where you really can't do a lot of the things that you might have been able to do before. Have you ever had a patient say that something that they can do because of physical therapy is better than it was even before their condition?
Yes, I had a patient. I have like so many things that happen in this clinic. So I had recently a lady. She is a teacher, and she works every day, and she was not able to move her shoulder further than this. So she was coming here because she has a hope that this will help, right? So her problem was like dressing, like putting her purse, then opening, driving, and everything. So I seen her as we speak about like hands-on approach. I tried some mobilization, and like right away she was all the way up here.
Oh, my word.
So she was so happy.
That's amazing.
And absolutely, she was like, thank you so much. And I think she's just working on the strength, and we might discharge her. I had another story that I had the same patient, like different patient. He used to work like a full time. He had the same problem. He was stuck here and not going up after a surgery, because this is important. After surgery, you need a rehab to get the motion and strength.
Absolutely.
So his work or insurance denied him, like, you cannot work more because you're not able to move. So that directly affected his family. So he was so depressed, and I was like, let's do it. So I did another hand approach with that guy, and he improved the range, and boom, he started working. He was crying and hugging me. I love this. I love this patient. Yeah, it is very emotional. Yeah,
absolutely. Well, I know that we provide tons of very specialty and comprehensive surgical services here that, you know, you might be referred from your physician over to this clinic for rehab. But if you do receive surgery at a different facility for whatever reason, could that patient still come and do the rehab here? Okay.
Yes, you can request your surgeon that, hey, this is my hometown, and this is where I want to go, and they can happily refer you here.
That's wonderful.
And I think they send directly electronically, so you don't have to worry about just call and schedule your time. Yes.
That's wonderful. Well, thank you so much, Nick.
No
we really
problem.
appreciate your work here and how you care for patients so well.
Thank you so much. Thank you for having me today. Thank you.
Now we're going to talk a little bit about occupational therapy. I'm excited to be here with Curtis. Thank you so much for being here. Can you introduce yourself a little bit to our community?
Yep, my name is Curtis. I've been an occupational therapist here with Hillsdale Hospital for around 9 years. I work in this outpatient department. I also work over at the hospital and all the departments over there as well.
Great. Can you tell us a little bit about what's the difference between physical and occupational therapy?
So, especially in this outpatient setting, occupational therapy is going to focus more on upper extremity injuries, whereas PT is going to focus more on lower extremity and back injuries.
Okay. And what are the types of conditions that OT treats here?
So typically in this clinic, I treat a lot of orthopedic conditions. So bone, muscle, ligament, tendon, that sort of thing. With shoulder, elbow, wrist, and hand. We also see different neurological conditions, mainly stroke. But anything that would affect, coordination, balance, things like that. Mostly in the upper extremities, PT would address mostly the balance in the lower extremity aspect of it.
What are the types of, can you give us some examples of goals that a patient might walk in with? Like, I want to be able to do this or that, or return to this kind of functioning.
Sure. So we work on a lot of range of motion, strengthening, and pain control, as well as coordination, different things depending on what you're here for. But the main goal is to get you back to as close to your baseline as possible. So what you were able to do prior to the injury is the goal.
That's great. Can you show us some examples of what kind of tools that a patient might use to work on that?
Sure. Well, here's a grip strengthener.
Okay.
Yeah, so just give us some squeezes.
Okay.
That would help with grip.
Oh, wow. That's a little bit more difficult than I was expecting.
Yeah, that one's actually pretty good.
Yeah.
This is a 9-hole peg test. This
Okay.
is going to work more on coordination.
Okay.
So
it's like a fun game, though.
Yeah.
That's great.
Yeah, absolutely.
Okay.
And we also have quite a few modalities that we use for pain control.
Okay.
So iontophoresis, ultrasound,
yes.
Electrical stimulation, hot pack, cold pack, those types of things.
Wow. So a lot of very creative approaches that are not always kind of the traditional things that I know make people nervous to approach therapy.
Sure.
If it's going to be really painful, but it's really about pain control
Absolutely.
ultimately and regaining those abilities. So
absolutely.
Great. Well, thank you so much. We're going to head over to our pediatrics room in just a minute to talk a little bit about that.
All right, let's do it.
We are now in our pediatrics OT room. Curtis, can you talk us through some of the goals and conditions that we deal with here for pediatric OT?
Yep. So in terms of what we do with the peds, typically it's working on delayed milestones. So we work on a lot of gross motor coordination, fine motor coordination, balance, those type of things to make sure that they are where they need to be for their age.
Okay, so those referrals might come from pediatricians.
Pediatricians, we get them for OT and PT. PT focuses more on the balance aspect. OT focuses more on the upper extremity coordination. So zipping a coat.
Yeah.
Picking up objects, anything like that.
Finer
gripping a fork.
Motor skills.
Yep. Fine motor skills will be focused on typically for OT.
Well, this is a fun space.
Yeah,
can you show us some of the things that you might do with the kids here?
Sure. Well, we use these mats and the stairs and all that over here. We set up obstacle courses a lot to kind of engage all senses, whether it's gross motor, fine motor, all of that in one.
Yeah,
so I do
that's so fun.
A lot of obstacle course type stuff.
Okay.
We use these peanuts for seated balance and might have them do some different activities with that. We even have a light break.
That's so fun.
Yeah. Yeah. So fine motor coordination,
yes.
Gross motor coordination, as well as engaging the senses.
I love that.
We have this little doodle board over here, so we can work on handwriting, things like that.
Yeah, just being very intentional about building those skills.
Sure.
Yeah, that's great.
Yeah.
Wow.
And then all this stuff we use in the obstacle courses.
Okay.
For the most part.
I think that's great, making it fun for them, but also obviously having some very clear goals. Do the parents always come in and kind of are involved in the process?
Typically, when we first start, the parents do come in just so we can get a better idea of what's going on at home, where they need help, that sort of thing.
Yeah, for sure.
But then typically for treatment sessions, we ask the parents to stay out there because the kids seem to be better engaged that way.
Oh, yeah.
We have had it work the other way, where the parents do come back, but typically they come back without the parents to stay more engaged.
Okay, so it can be kind of personalized just depending on their needs.
Sure.
So that's great. Well, thank you so much for being a guest. We appreciate what you do here and the work that the entire occupational therapy does.
All right. Thank you.
Thank you so much for watching our hospital rounds video so far. We have one more little interview to do. I'm excited to welcome Ahmed. Thank you so much for joining us on today's video. Ahmed is from CPS, which is the partner company that we use for providing our pharmacy in the hospital, our supply chain, and these rehab services. So they are kind of the foundation that we are able to build upon to serve the Hillsdale community. So Ahmed, can you share with us the vision and the mission of what we're doing here in Hillsdale?
Absolutely. Well, first of all, thank you for having me. The goal for CPS is really focused on three main pillars. Number one being that our focus is to provide high quality, one-on-one patient care that is evidence-based. And the goal really of that is to make sure that we provide optimal outcomes and high patient satisfaction.
Absolutely.
Number two is to make sure that we're doing that in an environment that patients feel safe in as well.
Yeah.
And last but not least, we want to make sure we're maintaining all regulations, whether that's federal, state, or payer specific. And we want to make sure that our staff is trained to provide the best quality outcomes for our patients.
Wonderful. Those are such important goals, and I know that you're accomplishing them because I hear the feedback of our staff and our patients, and it's just wonderful. So thank you so much for the work that you're doing and the work that the whole CPS team is doing to support the Hillsdale Hospital services that we are providing here for our local community. Thank you again for watching this video. Stay tuned for another installment of Hospital Rounds coming very soon. And remember, rural health strong.